Welcome back to Education Matters. Did you correctly answer false? Yes, that's right. The percentage of children in North Carolina without health insurance has actually been cut in half, from 8% to 4% since 2010. We're back to talk more about child well-being with the state's Secretary of the Department of Health and Human Services, Dr. Mandy Cohen. Secretary Cohen, thank you so much for being here.
Pleasure. Thank you for having me.
I should mention, I said, Dr. Cohen, you are an internal medicine physician by training, and before coming to North Carolina and taking over the helm at DHHS, you were heading up the was a Chief Operating Officer and Chief of Staff of the Centers for Medicare and Medicaid Services, which is a federal agency under DHHS. So thanks so much for being here. So you heard us talking with Layla before. You're obviously familiar with these things because really DHHS, you're all about delivery of health and human services, particularly for what? The children and for the elderly. I mean, that's a big part of your job, right?
For the vulnerable folks across North Carolina, whether it's disabled, children or the elderly. Yes, that's right.
Right. Well, the reason why we invited you on, and I've read and heard you speak before, is because you can't talk about education. We talk about K-12 education on the show most of the time, but you have to think about the children that we're trying to educate and basically what they're coming to when they come to school. What's their situation like, and then what's it like when they're not there.
Absolutely.
So tell me what your views are on sort of that connection.
Well, since I've come to North Carolina in the last 6 months, I've been doing a lot of listening and learning across the state. And one of the areas of focus of mine, I have 3, is on early childhood health and education, because it is so critical and so fundamental for someone's health and well-being for their whole life. Making sure that we get kids off to the best start in life, no matter what zip code they live in, across this state. It is a big focus of the governor's. I think you know his personal focus on education overall, but really a personal passion for early childhood education. And so you saw major investments in his budget, and we were happy to see the General Assembly take up some of those places. And so our department oversees, for example, the NC Pre-K program, where we help 25,000 kids get into pre-K, which is critical to making sure that they can make a good transition into grade school, get to that really important metric of good 3rd grade reading level, which really predicts whether or not they're going to finish high school. We also oversee the child care subsidy program, which speaks to making sure kids are in a loving and safe environment, one that is where they can be learning, but while mom and dad can be off working, and making sure we're thinking about family resiliency and stability for kids as they walk through life. And I think I'll remind folks that in the Medicaid and child health insurance program, we pay for half of the births in the state of North Carolina, half of them. And so when we know we need to do better there in terms of low birth weight and making sure that mom's getting prenatal care and that kids are getting off to the right start before they even enter the world. And so that's what we're really focused on. It's a continuum. It takes a lot of focus and energy. We have a great team, but we have a lot of work to do, as the numbers show.
Right, and that's one of the things that and the reason why I asked Layla about it too, was when we talk about things like Medicaid, particularly Medicaid, because I'm not sure, and I want our viewers to understand just how many children are served by a program like that, because I think it gets caught up, like everything does these days, right, in politics. But this is
1.2 million children are served by Medicaid and the Children's Health Insurance Program, 1.2 million. So we are very concerned if access to care would be affected for those kids. Again, being healthy allows those kids to get to school and to take advantage of those investments that we're making in the educational space. But if they come to school hungry, sick, tired, afraid, they're not going to be as successful. And that's why it's more than just what we're doing in the 4 walls of the school, but how are we thinking about their health overall and family resiliency and self-sufficiency. And so that there's a suite of programs that we at the state work on, but this is really a community-wide effort that we partner with many organizations across the state to help families.
And you mentioned early education and preschool being part of DHS. We actually have been making some positive investments in early childhood. The General Assembly, as in the governor's budget, we haven't completely eliminated the waiting list for, but
making a dent,
getting there,
and progress is great.
And I understand you're going to be working more closely with the Department of Public Instruction on a new effort. Tell me about that.
That's right. So thanks to some, again, work in the General Assembly, Assembly helping us establish an interagency council, because we know that transition from birth to 5 and then into grade school and through age 8. We know that's such an important continuum, and we want to make sure that the things that we're doing in early childhood make sure that they continue on into grade school. And how can we better link together the work that we're doing? Are we aligning metrics, and are we making our investments in a way that is supporting families, supporting those kids, supporting our teachers? And so I'm excited for that work. Again, that's really been ongoing, but now has an added level of attention and resource.
Now that you've been spending some more time in North Carolina, I know you've been out across the state. Are you surprised, or were you already well aware of? I called it the two North Carolinas, but the dramatic difference. You mentioned where a child is born, their zip code,
right.
is such a big factor. Does that surprise you at a state like this?
Yeah, unfortunately not. My work at the federal level, I think, was very aware of the challenges of rural America. I worked for that past Secretary of Health and Human Services, who was from rural West Virginia, and we talked about rural issues quite a lot. And so when I was coming here, I think I saw some of those. I think seeing it up close makes me think differently about how we want to address them here in North Carolina. One of the things that I think is top of mind for me when I think of rural issues is, one, access to care, certainly, and do we have the right folks to help folks in rural areas, but also brings to mind the opioid crisis.
I was going to ask you about that because that's been on the news. Bring that home for us.
Yeah, so it's one of those places where in rural areas where there isn't as much opportunity in terms of employment, we're seeing higher rates of opioid addiction. And it is a very complex issue that it's a whole show in and of itself, so invite me back. I'd love to talk about it. But it is something that is seeing a strain on families and on our kids. Right. And we're seeing our foster system really start to burst at the seams, unfortunately.
Yeah, I think I just saw a story this morning that the number of children in foster care has gone up something like 40% in the last 6 years, which is astonishing to me.
And we see a direct relationship between the opioid epidemic and that. And so I'm so appreciative of some work of, again, General Assembly, Senator Behringer and others working to think about how do we help the most vulnerable children in our community. Again, tackling the opioid crisis, I think, is going to be an integral part of that. We just released an action plan for the state that involves way more than the Department of Health and Human Services, but our Attorney General's office, and other law enforcement, as well as education, veteran community, and others. It's a tough problem. Again, foster kids and the foster system is one of the places in where we see this crisis really bubbling over.
Because of incarceration, but also, frankly, the social services that gets brought in when obviously it's an unsafe situation for the child.
But we have a lot of work to do, so I don't want to minimize how hard it will be to really turn the tide of that crisis and think about our vulnerable kids overall. These are really challenging issues, but I feel good that we're bringing the right coalition together to think hard about it. There's some fantastic leaders in this state in early childhood education and thinking about childhood advocacy, and I'm excited to work with them. I know we can solve this problem together.
Well, thank you for being here. There's a lot to cover. It's important work. So thanks for being here, Secretary.
Pleasure.
After the break, this week's Leadership Spotlight.